Here are the top 3 misconceptions about dementia that I want you to get clear about. I'm Dr. Ashanti Gajavira. I'm a board-certified neurologist and founder of HealthSpan Neurology, a practice where my mission is to change people's attitudes towards dementia from fear and anxiety into agency and action. Dementia is a preventable disease most of the time. Let's work on it. So let's start with that. Number 1 myth is that cognitive decline is just a part of aging and there's nothing we can do about it. So yes, there is some decline in cognition over time with age, but it is not progressive and it does not need to be disabling. In fact, many people will have excellent cognition into their 70s, 80s, and 90s, have very high functioning cognition, be able to stay well employed, extremely active, full of purpose. Now, some studies do indicate that we reach our cognitive peak as well as cognitive skill and brain volume in our early 30s, but that does not mean that dementia or a general gradual decline in cognition is inevitable. In fact, we also know that neuroplasticity and neurogenesis, which is the creation of new neurons in the brain, we know that that can occur well into our 90s. Plus, we know that while there is a gradual decrease, for example, in hippocampal volume on average, especially after the age of 65, by about 1% a year, we also know that in studies looking at patients who exercise regularly, we can actually increase hippocampal volume even after the age of 65 with a regular exercise protocol. So dementia is not inevitable. Progressive, disabling cognitive decline is not a normal part of aging. We can take action and be healthy and active cognitively into our 80s, 90s, maybe even 100. Number 2 misconception that I want to address is that there's nothing we can do about dementia. Well, I'm here to tell you that the majority of dementia cases are preventable. I have extensive other videos about this. I want you to watch those because it's really important to know. Every day I meet people who tell me, oh, why even get diagnosed with dementia? Why even address your cognitive risk factors? Why even think about dementia? My mom had dementia. Why should I worry about it so early? Because there's nothing I can do about it. Dementia is a preventable disorder the majority of times. A small number of dementia cases, maybe about 2%, are deterministically based on genetics, but the rest is affected by modifiable risk factors. There's so much we can do. The number 3 misconception I really think is important to address in thinking about dementia is that dementia starts only when we get older. It's a disease of our 70s and 80s. And here's the thing, dementia is a disease of midlife. That's right, you heard me say it, and I'm in midlife, I'm 55. But dementia is a disease that we know starts decades before symptoms begin. The process in the brain that leads to dementia, that is the changes in brain volume, the accumulation of misfolded proteins, the white matter changes, all of this, the vascular changes, all of this is starting early, decades earlier than the actual symptoms begin. So that means if a patient comes to me at the age of 80 with symptoms of dementia, their brain has started to have changes probably in their 50s, maybe even earlier. Now, why don't they have symptoms? Well, that's part of the wonder of the brain. It's because your brain is so incredibly resilient, right? We all know what that feels like to pull an all-nighter, or maybe to drink too much, or to be jet lagged. Your brain is a big muddled mess, right? But you can still pull off that meeting, you can still go on that date, you can still have a very functional brain because your brain is such a high achiever. It wants to do everything possible. It wants to do everything absolutely possible in order to function maximally, to please you, to do what you want it to do. So It's only once years and years of this injury that occurs, it's only after years of that that the brain actually then starts to show symptoms of cognitive decline. And it's then that we come in to see a neurologist for a diagnosis of dementia, but that change in the brain starts decades prior. And that change in the brain, that window of opportunity starting decades earlier, is just that. It is a window of opportunity. And we want to keep that as wide and open as possible by starting early. The only way to do that is to really take a concerted action and to have a specific brain-focused lens at looking at your health. Because I'll be honest, looking at just brain health alone, thinking about brain games and taking a supplement for your brain, that's not enough. Your brain is downstream to every single thing you do. So how you sleep, how you move, the nutritional intake that you get, your stress level, your environmental factors, your social supports, and yes, maybe the medications and supplements that you're on. But all of this plays a role in your brain health. And it needs to start decades before symptoms begin because, like I said, the changes in the brain start decades before symptoms begin. And doing that is exactly what I do in my cognitive longevity program as well as my mind over menopause programs. So both of these programs are geared towards individuals who don't have symptoms of dementia but have concern about a dementia risk, maybe because they have a family history and want to take proactive, evidence-informed steps in terms of gauging their dementia risk, understanding them, stratifying them in order so that they know where to focus their attention. And then over the course of an entire year, we work together to understand how to fit those steps into your life to make them possible, to make them happen. I invite you to explore more about my programs. You can look at my website, healthspanneurology.com, learn more about what I do, about my programs, about me and what motivates me, and then schedule a discovery call. It's free. We spend about 15 to 20 minutes and we talk about what I do, what you're looking for, and whether we're the right fit, and how to move forward from there. If you're interested in working with me, I encourage you to schedule that discovery call. You can also look at my website and find out about free webinars that I'm offering. The next set will start in the fall, and I really try to make these as helpful as possible. And the other thing you can do is sign up for my free newsletter, The Long Game. And in the long game, I talk about brain healthy tips that you can take, as well as about the approach and attitude that you need to have towards adopting a healthy life for your brain health in the future. I'm Dr. Ashanti Gajivira, and I represent HealthSpan Neurology. I would love to talk to you more. But remember, I am a doctor, but I am not your doctor. So all information provided today during this video is for educational information only, educational content only. Do not make any healthcare decisions based on the information provided today, and I encourage you to contact your healthcare provider if you're interested in, if you have any specific questions. If you're more interested in listening to topics about genetics, about the top 10 risks for dementia, or about how I really think dementia prevention needs to be part of your long-term financial planning, lots of videos like that. Subscribe to my channel and leave me a comment, ask me questions, tell me what you would like my next video to be about. I would love to hear from you. See you next time.